The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
Hi, this is Valerie Shivers, the host of Will You Trust Me, airing Saturday mornings at 11:30 a.m. We have offices in Sayville and in Garden City and can be reached at 631-569-4334 or on the web at shiverslg.com. Today, I wanted to go over the most common misconceptions regarding Medicaid. And it's kind of unbelievable because a lot of times when I sit with clients, they have very similar statements to be made. First and foremost, what I hear more often than any other misconception is Medicaid is for the poor. And when I say to a client, well, you're paying, $7,000 a month for home health aides, you should really consider Medicaid as an option. Or if it appears that your loved one is going to be going into a nursing home and you're facing a $15,000 a month bill, I'll tell them, don't worry, we can apply for Medicaid. And immediately the response is, well, no, I thought Medicaid was for the poor. Actually, it was initially designed for that purpose, to ensure that the impoverished did have access to health care. The problem is that, well, first of all, it is a federal program and it is state implemented. So the issue becomes, no one anticipated the longevity that we have today. People are living longer. People are living healthier lives. Access to medicine, medical science has improved greatly. And as a result, people are living much longer than they ever were. And as far as coverage for long-term care, it is so unbelievably expensive that it's something most people just can't afford. And there really is nothing out there aside from long-term care insurance. However, if you don't purchase that early enough or when you're healthy enough, it can also be something that is cost prohibitive for most people. So Medicaid, although initially designed for the impoverished, is something that's available and that we've all been paying into if we've worked. We've all been paying into the program with the hopes that if someday we ever do need it, we can kind of move our assets around to qualify. And the interesting thing is, anyone can qualify for Medicaid coverage, providing they've taken the steps to do the proper planning or that they have, planned in a crisis situation. So if they see themselves in a situation where they know that they're going to need care, well, let's discuss what we can do with the assets at that time. This kind of piggybacks on that first misconception. Second misconception is that Medicaid facilities are subpar. And that's actually not true. In fact, most facilities have some sort of Medicaid element. Now, it's important to differentiate between the different types of facilities that are there to provide long-term care. There is assisted living, and then there's nursing home care, which is really more of an institutionalized level of care. Assisted living is a facility where you're pretty much capable of doing a lot for yourself. However, maybe you need some assistance, right? Maybe you need some help with meal prep. Maybe you need some help with being reminded to take your medications. That's really where assisted living is a Viking. And assisted living, for the most part, is private pay in New York State. However, there are a few facilities in New York that do accept Medicaid for just the medical portion. And it's really considered more of a home care, community care Medicaid application because you are technically still in the community if you're in an assisted living facility. So the individual in that case is responsible for the room and board. However, all of the medical elements, the care aspect, is covered by Medicaid. Now, the alternative to that is, and by the way, those are far and few, and there are definitely some that we strongly recommend and others that we do not. So if that's something that is interesting to you, give us a call. I'm happy to discuss the pros and cons and explain to you, which assisted living facilities are really 5-star in our opinion. We do go periodically to the different assisted living facilities just to kind of vet and see who is, really providing wonderful care. And there are quite a number of them on Long Island. We're very fortunate. That being said, the alternative is a nursing home. Now, nursing home level of care, you have to qualify for, meaning you're not going into a nursing home if you just need some assistance with your meal prep. Most people in a nursing home are suffering from some serious, they have some serious needs that far exceed what an assisted living facility is going to qualify. And I would venture to say majority of the nursing homes on Long Island are private pay or accept Medicaid. And whether you're private pay or covered under Medicaid, you're getting the same exact type of care and level of care. The facilities are not concerned with how they're being paid. They're concerned with, are they being paid? So that being said, those are two very common misconceptions. Medicaid is simply for the poor, and also that Medicaid facilities are subpar. Another common misconception that I hear very often is Medicare, will cover my long-term care. I have Medicare. I am over the age of 65. I'm retired. I have Medicare. I have supplemental insurance. Won't Medicare cover my long-term care? And the answer to that is a resounding no. And it's actually amazing how many people don't understand that. Medicare covers the first 20 days of rehabilitative care in a facility. What that means is if you are in the hospital, let's say you fall and you're in the hospital and the hospital determines that you need a little bit of rehab, you move from the hospital to a rehab facility or to a portion of a nursing home that is considered rehabilitative. Medicare will cover the first 20 days in full, meaning there are no out-of-pocket costs to an individual who's receiving rehabilitation. Medicare will also cover the remaining 80 days up to 80%. So there very well may be a 20% copay starting on day 21 to day 100 that you're going to be responsible for. Sometimes people have supplemental insurance that will make up the difference and will cover that, that 20%, not always. The other caveat and very important thing to remember is in the event that you are no longer considered rehab, in the event that you hit a plateau, you're not improving, and the facilities will assess this week to week. In the event that you hit a plateau, Medicare may say, we're not paying anything. And they have the right to withdraw coverage at any time because, again, Medicare is not there for long-term coverage. Medicare is there simply for rehabilitative care. And if you are not getting rehabilitative care, if you're not improving, Medicare is no longer going to cover these costs. So what does that mean to you? Well, in that case, it's very important to recognize that if you or a loved one are in the hospital looking to be discharged into a rehab facility, irregardless of whether Medicare is going to pick up the first 20 days or you're going into rehab with the assumption of my plan is to come home, that's all well and good. However, it's very important that you give us a call so that we can discuss what happens next. What are your options? The last thing that you want to do is assume that you're going to be covered, and while receiving rehabilitative care, get a message from the facility that says, we're no longer going to be covered. You're going to have to pay out of pocket, and your coverage is going to jump from, let's just say the copay is $200 a day to $600 a day. That's some shocking news for an individual to receive, especially when either you or your loved one is in a situation where they're receiving care. They may not be in the best of health, and that's certainly not going to help things. So if you're in that case, if you're in that situation, if you feel that you might benefit from some education, and that's really what we're here for, we really want to make sure that you understand what's going to happen, what are going to be the ramifications of not properly planning. And a lot of times our clients really don't know what's going to happen. They're on day, let's say 15, they've been in rehab for 2 weeks. They come to us and say, what are the next steps? And at least we can pre-plan and start to gather documentation so that if they do receive that news, we can finagle assets and make sure that they're going to be qualified for Medicaid and they're not going to have these exorbitant out-of-pocket costs. We're going to take a quick break. This is Valerie Shivers, the host of Will You Trust Me, airing Saturday mornings at 11:30 a.m. We can be reached at 631-569-4334 or on the web at shiverslg.com. Hi, this is Valerie Shivers, the host of Will You Trust Me, airing Saturday mornings at 11:30 a.m. We are estate planning and elder law attorneys focused on asset protection. We have offices in Sayville and in Garden City and can be reached at 631-569-4334 or on the web at shiverslg.com. Before the break, we were talking about the most common misconceptions with regard to the Medicaid program. And I'll quickly recap the top 3. However, I do encourage you, if you missed the top 3, to listen in and check out my website, shiverslg.com. We do keep episodes on file, and this is really important and very informative. So I encourage you to check that out. The first is that Medicaid is a program designed only for the poor, and that cannot be further from the truth. If you really think about the costs of long-term care, some people are paying $7,000 to $8,000 a month for home health care out of pocket, and other people are paying $15,000, $16,000, $17,000 a month in a nursing home. Medicaid is a program that can help people. A lot of us don't find having that extra $15,000 bill per month, something that we can really handle. So Medicaid is there and available to assist with that. Also, that Medicaid facilities are subpar, and that's actually not the case. Most facilities on Long Island are covered by Medicaid or have some sort of Medicaid element. In fact, even some of the assisted living facilities also have a Medicaid aspect to cover some of the medical needs, activities of daily living. And Medicare will cover my long-term care. That is a very common misconception. Medicare coverage with regard to long-term care is very limited. It will cover the first 20 days of rehabilitative care only. And then the remaining 80 days so up to a maximum of 100 days, providing that an individual is actually improving. Medicare will cover 100 days of rehabilitative care, the first 20 days covered in full, the remaining 80 days at 80%, keeping in mind that if at any given time an individual hits a plateau, stops improving, Medicare can shut off completely and say, okay, well, we're no longer going to cover this care. Another common misconception that I want to discuss, and we'll get a little further into, is that an individual can own a home and still qualify for Medicaid. Now, that's actually not a misconception. It's a fact. However, it's important to know that even if you own a home, if you're going to be applying for Medicaid, you don't want to keep that home in your name if you can avoid it, because if you do, Medicaid is going to lien that home. So basically what this means is if I own a home in New York State and if I need to apply for Medicaid, they will ignore the fact that I own a home as far as eligibility is concerned. Okay. I can own a home and I can still be eligible for Medicaid, providing I meet all of the other financial requirements. The issue with this is if I'm receiving care at home and let's say Medicaid is paying out, I don't know, $7,000, $8,000 a month, even if Medicaid's covering $5,000 a month. If they're covering your entire nursing home bill, $15,000 a month, for every dollar that Medicaid spends on your care, they're going to attach a lien in the same amount on your home. So while it doesn't affect you during lifetime, it most certainly will affect your beneficiaries, because someday when you pass away, that home is going to potentially be sold. And when it's sold, that lien is going to rear its ugly head and it's going to have to be satisfied. So if you take into account the cost of an average nursing home, you could easily be paying $150,000 a year. If you're in a nursing home, that's $300,000, let's say for 2 years, that's a $300,000 lien that's going to be assessed on the home. And then when the home is sold someday, that lien is going to have to be satisfied from the sale proceeds. So while it sounds all nice and good to say, well, you can keep your home and still qualify for Medicaid, it's very important to speak with a professional to understand what the ramifications of that actually is, of doing that. A lot of times clients will come to us and say, oh, well, I'm working with the facility. They're doing the Medicaid application for me for free. Okay, but you own a home. Have they expressed to you what's going to happen if you apply for Medicaid, get coverage, and still maintain that home in your name? And a lot of times people don't recognize that because the facilities are interested in making sure that they're going to be getting paid and that the individual is going to be receiving the care. However, they're not as interested in making sure that your assets are protected. That's where we come into play. And as far as any sort of transfer of assets, it's very important that you speak with a professional to know, well, is there anywhere we can transfer that home and still qualify and not be penalized? Or maybe you should sell the home and at the very least, we'd be able to protect 50 or 60% of the value of that home upon the sale. So these are things that you definitely want to consider. Come in and discuss with us if you find yourself in this situation. Another misconception is I just don't qualify for Medicaid. When I tell a client, you may want to consider Medicaid. Why are you paying out of pocket? This is really exorbitant as far as costs are concerned. The issue with that is, well, absolutely, Medicaid's out there and available as an option, but you have to take the steps to apply and you have to listen to what we have to say with regard to transferring assets. Most of my clients, when they meet with us, do not qualify for Medicaid. Most of my clients' assets exceed the Medicaid limits. Most of my clients make too much in monthly income to qualify for Medicaid. Our job, and to be quite honest with you, one of the best parts of my job is looking at the puzzle piece that is your estate, that is your income, your resources, and moving things around to say, okay, what do we need to do to protect all of this, to protect everything that you've worked so hard for and make sure that you get the coverage you're entitled to? What next? And to kind of formulate a plan for you and give you a step-by-step set of instructions of what needs to happen in order to qualify you for Medicaid. To be completely honest with you, if a client contacts us and says, I need a Medicaid application, and I sit down with them and say, okay, what do we have as far as assets are concerned? If they don't have any assets, I'm going to be very frank with them and I'm going to say, you can do this yourself. You don't need us, okay? The client who owns anything, the client who owns a home needs assistance when it comes to applying for Medicaid. Finally, the misconception that really drives me up a wall is I'm gaming this system by doing Medicaid planning. No one is fooling anyone here. Medicaid has resource limitations. Medicaid has income limitations, but we as attorneys are trained to figure out ways to make sure that you meet those limitations and that we are there to utilize what's available to us. Perhaps it's utilizing an irrevocable trust. Perhaps it's utilizing a caregiver child. There are so many things that we can do to protect an individual's assets. I have clients who have quite a lot of money who are able to transfer those assets. By the way, they've worked incredibly hard to get what they have, and we are able to transfer assets and apply for Medicaid and get the coverage that they need and that they're entitled to. In addition to that, we have clients who don't have exorbitant amount of money, but they've worked very, very hard to accumulate what they have, and we're there to help them and to make sure that those assets are protected and, again, apply for Medicaid. Everything that we do is legal. When a client says to us, okay, well, you're preparing this trust, you're telling me to transfer assets out of my name, you're telling me to do a deed transfer, you're telling me to move things here, is that legal? The answer is a resounding yes. Absolutely. Everything that we do, it's a plan. In fact, we let Medicaid know, we let the Department of Social Services know exactly what we've done. We have to show them either a 3-month snapshot for home care or a 5-year snapshot for long-term care. We show them exactly what we've done in order to qualify an individual. And if we've done it right, which we pride ourselves on doing, we're going to protect your assets as much as we possibly can. And we're going to make sure that you get the care that you need at the lowest possible cost. Again, this is Valerie Shivers. I can be reached at 631-569-4334 or on the web at shiverslg.com. Have a great weekend.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.